Maria Rosario Viriri. Now, despite the need for a safe vaccine prior actually for vaccination uptake and vaccination hesitancy, it is actually becoming an issue as countries try to reclaim some semblance of routine and economies recover. Now, according to studies, communities and individuals can be influenced to participate in immunization through developing trust through effective and respectful communication. Now, as well as, of course, following the next speaker for the morning session, Dr. Maria Rosario Viriri will talk about building vaccine confidence through organizational engagement. Now, to introduce our speaker for today, Dr. Maria Rosario Viriri is the current OIC, Undersecretary for the Public Health Services team, and the official spokesperson of the Public Health Services team and the department, DOH. She was actually the previously OIC USEC of Health Regulation Team and Assistant Secretary in charge of the Public Health Services Team. She also acted as the OIC Deputy Director for the General Field Regulatory Operation, Food and Drug Administration, Office Director of the Health Facilities and Services Regulatory Bureau, and the Chief of the Health Research Division of the Health Policy Development and Planning Bureau. Undersecretary Virgiri has committed decades to public service, having worked in Marikina City Health Office before joining the Department of Health in 2007. Now, aside from the public service, she is also committed to nurturing our soon-to-be public health leaders, serving as faculty at the Development Academy of the Philippines and part-time faculty in Ateneo School of Government. Now, she also obtained her undergraduate degree in zoology from the University of Santo Tomas, her MD from the De La Salle University College of Medicine, and her MPH from the University of the Philippines. Now, to get some of her insights into the topic, let's call on Dr. Maria Rosario Viriri, OIC Undersecretary and Spokesperson of the Department of Health. Okay. All right, we like to call on Dr. Verhiri if she's around already. Okay, while Dr. Verhiri is preparing for his her presentation, would like again to invite everyone to please visit our virtual booths and our partners at our website at www.phrassembly.com/live. Okay, I guess we have Dr. Verhiri now. Okay, take it away, Dr. Viriri.
Good afternoon to all of you. I would like to thank the certified practitioners in human resources for inviting the Department of Health to the 4th Philippine Human Resources Assembly. The Department of Health extends its sincerest gratitude to the certified practitioners in human resources for conducting fora and webinars such as this, as they aid in our two-pronged approach in fighting both the pandemic and the infodemic. We cannot overemphasize the role that you play during this time of crisis for our fellow Filipinos. As of November 16, we have fully vaccinated over 32.2 million Filipinos, while over 39.4 million had been partially vaccinated. As we open vaccination to the rest of the adult population, we hope to continue these gains. We need the help of all of our sectors to encourage vaccination for those unvaccinated from their circles, whether their families, their community, or their organizations. For this discussion, I have 6 key points to discuss on how organizational engagement can help address vaccine hesitancy with their groups. We'll go through them one by one, and hopefully, these steps can guide HR practitioners in implementing activities in their respective organizations. First, we must share information from trusted sources and circulate this information within your organization. It is important to highlight that we disseminate accurate and factual information. This must be sourced from trusted and verified sectors. This information is one of the biggest drivers of vaccine hesitancy. Unfortunately, we see this every day in our social media feed or group chats and in our discussions among family members and colleagues in the workplace. When people receive wrong information, it is highly likely that they will not longer choose to be vaccinated due to fears or unfounded concerns about the vaccine. Organizations have a valuable role in combating disinformation and ensuring that their members are properly informed. The good thing about looking for valid information is that this information is readily available. The DOH page and website contain all of the information you need to know about the vaccine. These platforms are regularly updated by the Department of Health. Healthcare workers and local government units are also trained to respond to vaccine-related concerns. The PHRA chat box is also another reliable source of information. This is a free service that is accessible through the DOH Facebook page. PHRA can respond to your questions about the COVID-19 vaccines. The great thing is organizations don't need to produce their own materials for information about the COVID-19 vaccine. You may find IEC materials and infographics in the link on the slide, which contain information validated by the Department of Health. We enjoin HR practitioners to be agents of correct and accurate information to end disinformation about the country's vaccination program. Second, it is important to identify the main reasons for hesitancy among the members of your organization. People have different reasons for being fearful of getting the vaccines, and it is shown by the different studies and surveys. Some people are afraid that they are not safe or that they are not effective against COVID and its variants. Some people are also unaware of the cost that they might incur to get vaccinated. We must find out what each member of our organization is worried about so that we can respond accordingly. How we can find these sentiments? To do social listening, we should organize organizational discussions or conduct anonymous surveys to hear what people have to say. Through open-ended discussions, members of the organization are given the chance to talk about their hesitancy and how the organization can help address this concern. Meanwhile, surveys can help identify how many are hesitant and what kind of messages or information to focus on in your respective communication plans. These activities can help give you a full perspective of what your organization thinks about the COVID-19 vaccine. Understanding workplace sentiments is important to know the information needs of the organization, to be strategic in your information campaign on the concerns of your employees, and to exercise empathy when communicating to your employees. Empathy is a key part of implementing a communication plan for addressing vaccine hesitancy. If the questions are promptly addressed, members feel listened to and trust the information that they receive. Third, organizing learning sessions with experts can be key to addressing the concerns you have identified in the previous steps. It's helpful when people are given the chance to directly interact with experts to discuss their concerns. People generally trust scientific and medical experts, and hearing from them boosts their trust for the vaccination program. It is relatively easy to organize these learning sessions for your organization. One way is by contacting your local government that trains communications to give talks and facilitate discussions with your organization. Medical societies also have local chapters that are very much willing to support activities that advocate for COVID-19 vaccination. Organizations are not alone in advocating for the vaccine, and reaching out to partners is the best way to encourage trust within your organization. Fourth, you may select leaders and members from your organization to become vaccine champions to advocate for COVID-19 vaccination. We know that people around us greatly shape how we think. The average person generally spends most of their day with colleagues in workplaces, and other people within their organization can change or reinforce how they see certain topics, including COVID-19 vaccines. If organizations involve members of their community to be vaccine champions, it creates a culture of support and openness about vaccines. Organizations should feature members from all parts of their team, from leaders to staff. Employees must be given the opportunity to discuss vaccination during company meetings and gatherings and feature them in public places. There is also a need to encourage members of the community to talk to these champions and to ensure that they can respond to them. Fifth, organizations should implement supportive policies to encourage uptake in their group. Sometimes vaccine hesitancy is exacerbated by structural barriers that prevent vaccination. For one, vaccination centers may be inaccessible. Employees might think that they'll incur penalties for missing work due to their vaccination dates. They may have responsibilities at home that prevent them from getting vaccinated outside of their work hours. If organizations implement supportive policies, employees find that organizations value their members and build an enabling culture for vaccination. Some possible support that organizations can implement are the following. Some organizations provide transportation services from their offices to vaccination centers. Some conduct vaccination in their own workplace through the help of their local government units and include eligible family members. Implementing paid leaves for the schedule of their vaccination date may also address the hesitancy over getting penalized over their absence. Beyond giving information, addressing these structural barriers might be the key that can change their minds. Organization with the means should consider this to improve coverage in their community. Lastly, it is important to celebrate your organization's success as you move forward with your vaccination drive. Every Filipino vaccinated is another Filipino protected from severe COVID-19. In the same way, every member of your organization that is vaccinated means your organization is that much more resilient and stronger. Celebrating milestones in coverage is one example for this. Informing members of your organization that a certain percentage of your organization has already been vaccinated is a sign that people are interested in vaccination. Another way is by implementing simple but highly visible activities. Giving away stickers or pins has been implemented by many local governments and organizations for their community. Photo booths made available in the post-vaccination area also allow members to be their own champion and to show their enthusiasm. Creating an atmosphere of celebration will encourage vaccination. People would want to join the vaccination bandwagon. In summary, these are the steps that we hope you can implement in your organization to address vaccine hesitancy. Your organization may have different needs, but please see this as a guide on being advocates for the COVID-19 vaccine. At the end of the day, the message we want to impart with you is this. COVID-19 vaccines are safe, effective, and free. We hope that you can be our champions in your organizations and share this message to everyone. We cannot do this alone, and your support will be necessary and significant to end this pandemic. Thank you very much, and good afternoon to all of you.
So with that, again, we'd like to thank our guest, no, Dr. Maria Rosario Virhiri, the OIC Undersecretary and spokesperson of the Department of Health. Now, it's actually best, no, really to break the barriers, no, of hesitation, no, as the employees, no, tend to be more scared, no, because they think that the vaccine are not working. They think that the vaccine are very dangerous. Actually, it's really more about developing a trust through effective and respectful communication. So I'm sure, no, that will be a challenge accepted. So ensure that we build, no, vaccine confidence, no, as we go through this pandemic situation. And actually, we are very happy to inform everyone about the news that we're currently receiving from the LGU, no, from our government in our respective community, that we're really on our pathway to recovery. So that is why, it's best that protect ourselves, no, and of course, no, have a herd immunity. So we really need to build, no, a trust, no, and have vaccine confidence, no, through our support as leaders, no, for a vaccination, no, project, no, and this will help eliminate the poor vaccination and vaccination hesitancy as it was becoming an issue for others. So again, grab that as the challenge, no, accepted.